Hey guys, Nathan here. Today I want to talk to you a little bit about scene survey. Just some things you should do before and during when you arrive on the scene, no matter what the call may be. One of the first things you're going to want to do before you even arrive on the scene is prepare your BSI, or your body substance isolation. The most common is gloves, glasses, but if there's going to be blood involved or vomitus or if they're on droplet precautions, a mask, gown, or respiratory mask, it never hurts for that. You're going to make sure your scene is safe. It could be anything from chemical, electrical, it could be thermal. Is it really hot in there? Was there a fire? Is there a fire? Or your hazards on the scene, like environmental hazards, such as hostiles, any bystanders. Beware of spaces that inhibit you from giving the utmost patient care. And when you arrive on the scene, you're going to want to determine your mechanism of injury and your nature of illness. Generally when you walk in, you can tell the patient is sick or not sick. Your facial expressions, your eye contact when you walk in the room, how are they dressed, how's their hygiene, do they speak to you when you walk up, what's the odors, do you smell any sweetness on the breath, which indicates ketoacidosis or alcohol, or anything that could lead you in the right direction of index of suspicion, and patient care. Your mechanism of injury, if it's a car accident, how did it happen? What happened? Was it a frontal, lateral, rear rollover? Were they wearing their seat belts? Is there signs they hit the steering wheel or their head hit the windshield? Just be wary of that, because this will help you in your index of suspicion and finding the proper treatment plan. The number of patients on the scene, that's a big one. One patient generally won't deplete your resources. And if you're an EMTB, um, call for a paramedic if you need further assistance, or the knowledge, or if it's chest pain or respiratory problems. Don't be afraid to call. If you're a paramedic, call the fire department if you need help extricating a patient from a vehicle, or if there's a fire on scene. Call the law if there's hostiles around or anything that just throws you off as not right. Let the officer give you the go ahead before you risk your life. Um, Call air evac if your patient's critical and he meets all the criteria for air evac. Don't be afraid to call air evac if you need it, or the National Guard for whatever reason, what have you. Just don't be a prideful EMT. It could cause you your life and the patient's well-being as well. So if you need help, call for help. Um, you're going to want to consider the C-spine. You walk onto a scene, the patient's laying on the floor. You don't know if hit her head, neck, whatever. C-spine should be considered for all patients. If you walk on the scene and grandma's sitting on a couch in tripod position, gasping for air, you might not want to put a C-collar on her in that situation, unless she tells you she just had a fall and she just hit her head. Then you would definitely want to consider that C-spine. Alright, guys, this is just some of the things you should do. This is your scene survey before and during the scene. Assessing the scene, is it safe, mechanism of injury, number of patients, additional resources, consider um, C-collar, C-spine, spine stabilization, um, C-collar, backboard, what have you. Alright, guys, thank you for listening. Stay tuned for more.